Welcome to our video covering the Inguinal Canal and its related structures. We begin our journey with the beautiful right male hemipelvis, which will make the basis of everything we cover today. The first structure we see is the inguinal ligament, running from the anterior superior iliac spine to the pubic tubercle. This will make the floor of our inguinal canal. Coming in next, we have a section of the external oblique muscle, which forms the anterior wall of the inguinal canal. Following from this, we have the internal oblique and transversus abdominis muscles, respectively, and together these create the anterior lateral aspect of the abdominal wall. As you can see here, the aponeuroses of the internal oblique and transversus abdominis come together to form the conjoint tendon. This will extend inferior medially to eventually join the external oblique aponeuroses. Now we will go deep beyond the muscles, where we meet the transversalis fascia and the parietal peritoneum immediately deep to that. The transversalis fascia forms the posterior wall of the canal and also contributes to the roof alongside the internal oblique and transversus abdominis. Now we move on to the blood vessels, where we will look at the external iliac vessels. The external iliac artery progresses distally until it passes under the inguinal ligament, where it transforms into the femoral artery. The external iliac vein progresses in a similar fashion to form the femoral vein. Branching off the external iliac vessels, we have the inferior epigastric artery and the inferior epigastric vein. They are sandwiched in between the transversalis fascia and the parietal peritoneum at this level, but further up their course, they pierce through the transversalis fascia. Now we will discuss the vital contents contained within the inguinal canal. Most structures enter through the deep inguinal ring, and in order to view this, we will isolate the transversalis fascia. Now we can see the hole in the layer, which is found lateral to the epigastric vessels, and this is our deep inguinal ring. The exit to the canal for most structures is the superficial inguinal ring, which is formed via a defect in the aponeuroses of the external oblique muscle and is just superior to the pubic tubercle. The main structure running through these rings is the spermatic cord, but in order to visualize this, we will hide the layers of muscle. Now, from superficial to deep, the layers of the cord are the external spermatic fascia, the cremaster layer, and the internal spermatic fascia. Through the lumen of the cord, we can see the testicular artery. The testicular vein follows the same course as the artery, but is not seen in this model. We can also see the vas deferens and the genital branch of the genitofemoral nerve passing through the lumen. The genital branch of this nerve pierces the external spermatic fascia and then runs between this and the cremaster layer. On the subject of nerves, we have also included the ilioinguinal nerve, which is not only excluded from the spermatic cord, but does not enter the canal via the deep inguinal ring. It instead pierces through the abdominal muscles. Now we can see the cord terminating at the testi. To the model, we will now add the urinary bladder and the ureters. Following the path of the vas deferens as it leaves the deep inguinal ring, we can see it traversing over the ureter. Helpfully remembered by the phrase water under the bridge, the water represents the urine in the ureter and the vas deferens passes over this. Now finally we see the bladder with its layer of visceral peritoneum, but in the model we have only displayed half of the peritoneum. We hope you have found this video helpful, and we thank you for taking the time to watch.